That was fantastic, and another great example of how important it is to look outside your own small world for inspiration, leadership, and inspiration. So one of the things we promised you for today, one of the action steps, one of the deliverables of this year's meeting is the National Clinical Alert, Young Adult Colorectal Cancer Clinical Alert. So I just want to stress the tremendous amount of work that went into this. Dr. Albert and Erin Peterson are going to talk to you about it, but it's in your packets, and I think you can see that it's a potentially very powerful tool. It's one piece of paper, and if every primary care physician in this country read this one piece of paper and taped it somewhere on their desk, we could probably save a lot of lives. But I'll let Dr. Albert explain to you the genius of what they've accomplished.
Okay. Good afternoon. I'm Dr. Andrew Albert, Medical Director of Digestive Health at Advocate Illinois Masonic Medical Center in Chicago, the second city. Happy to be back in my hometown of New York. I function in the capacity of working within 13 hospitals, now 23, at Advocate Aurora Health Care. Just a quick question. How many physicians are in the room? Raise your hand. Wow, okay. How many survivors are in the room? Okay, so I just want to say, physicians will get to you in a second. Survivors, thank you for making every day so important to our work. We're so grateful to you, and you drive us tremendously, so thank you for that. So this clinical alert was drafted by a number of us to sort of emphasize the things that primary care doctors, but other providers can do to help convey a degree of urgency, some compelling statistics, overview of the early adult onset signs and symptoms, statistics relevant to family history that PCPs and other providers may not know, but also ways practitioners can help. What can providers do? They can educate the public and clinical staff about the early adult onset and family history. But what's so special about this alert is that it's geared toward not just PCPs, but other providers. PCPs are busy. They're really busy people. And so it's important to think about who else touches patients early, those 5 visits before a patient comes in at the age of 33. How do we get to them? OBGYNs, ER doctors, surgeons, occupational health, even community health physicians touch these lives. Something to think about. Early assessment with physical exam. The physical exam, there's a reason you don't do a physical exam, and that's no rectum and no finger. So every physician or every medical doctor should be doing a physical exam. A lot of times people say it's just a hemorrhoid, but it's important that if you don't see a hemorrhoid, it's got to be something else. We need to educate patients on the basics of digestive health. Health literacy is something we haven't spoken about enough today. It's really important that patients know basics about their GI tract. We need to help all of our clinical staff members understand the importance of this mission. And so I guess now if you think about the clinical alert that we came up with to outline all of these different things, the importance, the statistics, is that game over? Is that it? So we go back to our offices, we have our clinical alerts, we share them, we may put them on the desk in front of us. What next? Have we succeeded? And I would actually venture, I guess, to say, no, you haven't succeeded. And I would actually venture to say that maybe we could all do better. One thing to think about as I've gone out in the community is that we only see the tip of the iceberg. I understand my academic colleagues and my private practice colleagues, I understand that they see patients in their office. The real question is, what about those people you haven't touched? What about those people you haven't spoken to? Those clinical alerts are important to heighten your awareness in the office, but what about the other people as well? You're busy, you're in meetings, you go to your clinic, you educate, you repeat, meeting, clinic, we've all been there. But one thing I want to pose is that maybe we're speaking to the same patients over and over and over again, and maybe there's opportunity to speak to others, especially using this clinical alert. PCPs, I said, are busy. I was just at Starbucks in downtown Chicago a month or 2 ago, and I said, hey, Jim, how's your fit testing going? He's a PCP. And he said, oh, I don't do fit tests. I'm like, why? Why wouldn't you do a fit test? I'm too busy. I just refer every patient to you for a colonoscopy. That was his answer. Something to think about. Additionally, the medical community is busy with all their initiatives, all their ACO contracts, all the things they're supposed to be doing. They're swamped. Maybe we're not reaching the right people. We make assumptions also about health literacy. Some people don't know much about their GI tract. Why am I saying all this, and how could I say such things? Candace Henley and I, Candace is a stage 2 survivor. We got a grant from the Colon Cancer Coalition to go out into the community to lecture on the colon and give out fit tests. These are some important things that we learned. Somebody last week said, my brother's 33, they died of colon cancer. Do I need to be checked? This is a person who's never been to the doctor, so how do you reach them, right? How many, I ask in every talk, how many of you know it's Colon Cancer Awareness Month in March? None of these people, well, I know you know. I know you know. That's the point, is that we're constantly saying that we all know. But the 1,000 people in downtown Chicago do not have a clue what the heck Colon Cancer Awareness Month is. That's really powerful stuff. And then the most upsetting and hard thing is I gave a talk like this, and at the end of speaking about colon cancer with Candace, the whole time, a young man of 25 raises his hand and he says, I'm so sorry, but can you tell me what the colon is? Okay? But this is the reality outside, in the academic world, in our practice world, we see people because they come into us. But these are the people that don't come in, and that's what I want to expand your minds about. The elephant in the room is that health literacy is an issue. People don't know what they don't know. I think Dr. Weber said that, or if I only knew sooner or known before. Those are powerful words. So I'm asking everyone in this room to take the alert one step further. We gave you this alert with all the succinct things you need to share with doctors, to share with patients, to share with people. Don't just put it on your desk and say, this is a great reference. I'm going to look at this 10 times this week and then eventually clean my desk. Share this alert with your colleagues. So this clinical alert for OBGYNs, let's say they don't know how to, what to do with the clinical alert. Well, then have a focus group as a gastroenterologist or someone who knows the space and help them. Help your colleagues understand how they can make this clinical alert a more effective piece, a tool. Invite other colleagues. I just realized in writing an article that there are 15,000 gastroenterologists in this country. And I'm humbled by the fact that if each one of them donated a day, what would happen next? So I wonder how many people we can ask to join us in this mission. And Dr. Newcomer and I were talking about this earlier, that he's done such a great job in North Carolina, but getting people engaged. How do we share this information? I went out to the corporate setting. Maybe other doctors here could take their clinical alerts and speak to them in the community setting, the religious setting, anywhere else but just in your office. I'm asking you to go beyond. I'm assuming that you're all going to speak about your clinical alerts in your office. We need to get to the bottom of the iceberg if we're going to impact these amazing young people who just don't know what they don't know. And then I'm asking you to do something. I'm asking everyone in this room to make a commitment to doing something. Yes, use the clinical alert. Do something different is my ask. Now, I do some crazy things like biking through Chicago with a sign on my back. I've been known to stand in the middle of oncoming traffic holding up a sign during Colon Cancer Awareness Month. But I know that there are a lot of you who are creative people. And I understand that we focus on what we do in the office, and I get all of that. The question is, what can you do different? And I thank you for your attention.
So my name is Erin Peterson. I'm the Communications Director for the Colon Cancer Coalition. We're a nonprofit advocacy organization based out of Minneapolis. I want to talk about reaching the bottom of the iceberg. Is this working? Literally the same. Click, there we go. So we did a internal survey talking to about 430 survivors, and we wanted to know not just their experience, but what would have helped them get screened, what would have been that message that they needed to hear before they were diagnosed that would have maybe increased the time between that initial symptom and then actually going to the doctor. What surprised us, or maybe not surprised us, was that 75% didn't even know that young people could be diagnosed with colon cancer, and that 75% also had symptoms that they either tried to self-treat or ignore. So if they knew the symptoms, is there something that they would have done earlier? We also asked them if they had symptoms, what were they? And these are all the same lists that we've been seeing all day. But then what would that message be that would make a difference, that would have made a difference to you? And overwhelmingly, we heard that blood in your stool is not normal, because overwhelmingly, that's one of the symptoms that they reported. How do you want to see these messages? Again, going back to kind of what we heard earlier from the Ad Council, that broad, overreaching message, where are we going to reach these people? So we took this information, and we are fortunate with our Get Your Ear and Gear races to have some relationships that we can leverage to do some campaigns. So this was in Boston alone in September. We're like, where can we reach people that's unexpected? They're not going to expect to see colon cancer awareness messaging on the streets of Boston. So we spent $30,000 in some additional in-kind support that doubled that to reach 27 million impressions in 1 month. With that, blood in your stool is not normal. 1 in 23 people will be diagnosed, and then the unexplained weight loss is not normal, and know your colon cancer symptoms. We partnered this with an online and print campaign in the Metro. It's a alternative newspaper there that had, again, we spent about $5,000 on this campaign, plus doubled that with additional in-kind support to reach another 1.2 million impressions with the same messaging. So that's my challenge, is how do we reach the bottom of the iceberg? And that's where our advocacy organizations can really step in as well, in addition to our physicians. And this campaign wasn't directly for young onset, but we really tried to tailor it with messages that could reach the younger population, and hopefully so when they do experience the symptoms, they know what they can do about it.